Hello, this is Dr. John Brimhall. With me tonight is Dr. Curtis Turchin. I'm having a little connection problem, so I'm not going to talk long, but Dr. Turchin is one of our homecoming speakers, January 4 through 6 here in Phoenix, Arizona. You sure want to find out the details on that and get registered early, as it is the tail end of the New Year celebration. We have an incredible lineup here, and Dr. Turchin is going to be teaching laser there, demonstrating new techniques and new equipment. He's not only an incredible practitioner, he is also an inventor and works with laser companies and helping them to innovate some of the highest, most powerful cold lasers in the world. Dr. Turchin, let me turn the time over to you before my computer kicks out.
All right. Well, thank you, John, and welcome, everybody. I think you'll find this interesting. I'm going to present some ideas I think you're going to find unique and stimulating. So if you want to learn more about this, I do have a website that I'm developing for my teaching practice, and it's gentlemobilization.com. And it could be for you to teach you whether you want LiteForce technique, gentle techniques, or you want to train your therapist for massage and stuff like that. Okay. So what I want to go over is three new concepts that I think you're going to find interesting. One is that subluxations are in predictable patterns and that innate actually creates subluxations. The second is without light, we're going to get sick. And that light is a necessary part of innate. And for innate to function well, you have to have light. And if you adjust using what I call innate mobilization or innate adjusting techniques, you'll find everything will be easier, and you're going to learn about what I call following the flow, not following line of drive. So the important thing, number one, is to realize that all bodies are asymmetric, and they're asymmetric for a reason. People are not generally straight. We think, I remember learning, trying to get people to 0 over 0 and biomechanics and things like that. And it is important in your adjusting and treatment paradigms to try to get people to be straighter. But remember that these subluxations and some of these patterns are actually baked into us. So what we do is we look for subluxations, we look for joint problems, muscle problems, posture misalignments. We do adjustments and modalities. But how do we adjust? Hit the high spots, rack them, crack them. What do you do? I mean, what is the technique you use to figure out where to go? Do you do muscle testing or leg testing or whatever? The important thing to remember is that these subluxations and these patterns are baked into the human frame. You don't need to do a leg check or a muscle test to know if people are right-handed, because I'm sure you know this, 90% of your patients are right-handed and 10% are left-handed. And of those 10% that are left-handed, 60% are ambidextrous. So when you see a patient, I'm going to show you some of how you can learn to assess them in a predictable pattern. So you're going to find that these subluxations, the same ones, are going to occur over and over again because this asymmetry is baked in. So why are we asymmetric? Well, if you were a primitive person living 7 million years ago, 1 million years ago, 100,000 years ago, you were a hunter-gatherer. And you can see this guy trying to make some flint, and they would use flint, for their arrows, for their spears. They would just take pieces of flint and they would crack people's heads open when there was warfare. So what they had to do is they had to take one piece of flint and chip off other pieces of flint that were the right size to make a tool, whether it's to kill an animal, kill a person. Well, you don't want to cut your fingers off. So the right hand developed more strength and the left hand developed more spatial relations. So that was part of the start of us becoming more, I would say, unilateral in many ways. And what this produces is the ability of us to understand the human body in a way that we accept this asymmetry, and we can look at almost every patient and find the exact same subluxation patterns. Once I learned this, I'll tell you, adjusting is really easy. Whether you go back 100 years ago, 1,000 years ago, a year ago, a million years ago, people use similar postures. You see that there's a tendency to have the right leg back, the right arm back, and then to throw in a certain pattern, or throw a spear in a certain pattern. We tend to use these same postures over and over and over again. And these postures are postures that are based on how we've evolved over 7 million years. So the fact that a quarterback throws in a certain way is not because he chooses to do that. He doesn't choose to be right-handed or left-handed. He's born that way. He's born with a stronger right leg. He's born with asymmetric vision. And all of this has to do with how our patients present themselves when they come into our offices. So people use their bodies the same way, and they have to because that's how they're designed. And I would say that I would take the term innate, which is an important word, in chiropractic and for, D.D. Palmer. And that innate is something that formed us in these ways to make us more efficient. So you're going to find that historically, people have used their bodies in the same way, and they use their bodies in the same way now. You can see these postures occur over and over again. And that is what shapes these subluxation patterns, is you see the same shape occurring over and over again. So I think we can all accept that 90% of us are right-handed, 10% of us are left-handed. And I'm now going to show you that this is not anything that is random. It's very consistent, and this asymmetry is something that's very important. So if we say raise your hand, most people raise their right hand. You can see there's old Donald. You can see there's Obama. They're all raising that right hand, even in the area of rock and roll. There's our friend Arnold Schwarzenegger, the ex-governor of California. So these are ways that we're going to behave whether we want to or not. There's something called the law of supply and demand. I think you've heard that. But you can also say if you demand certain movements out of the body will change. And this is part of the basis of evolution. What we learned in chiropractic school was that form follows function. And that's all I'm talking about, is that we've behaved in a certain way for so many years that our subluxations are very predictable. Well, believe it or not, animals were asymmetric before humans. Even invertebrates are asymmetric. It's known that most toads are right forelib dominant, and most fish show right eye dominant preferences. So this is something that is not a problem, it's actually the way we're designed. And these subluxation patterns are based on evolution. So it's true in the fetus too. 70% of kids move their right arm more than their left, and they suck their right thumb more than their left. That's also going to parallel that the brain, the cerebrum, is asymmetric as well, because of course right-handed people have a bigger left brain. So asymmetry is normal. Most of us have a right short leg. Some people have a left short leg. The right leg is stronger than the left. And along with that, because our right side is dominant, our left cerebral cortex is bigger. And because the left cortex is bigger, the left side of the head is bigger. And that's going to produce certain kinds of atlas subluxations. Now, the nervous system is plastic, and the nervous system, the brain, the cranium, all these things are adapting to developments in evolution that make us more functional. 2/3 of chimps are right-handed. They usually throw right-handed, especially in gesturing and throwing. So these things are common asymmetries. Studies show that in 85 to 90% of the patients, the chronic sciatic pain and the hip symptoms occur on the long leg side. I think that occurs because on the long leg, there's more pressure going superiorward, and that pinches the disc on that side, and it makes it bulge, and it also damages the left acetabulum because of the increased pressure. So you're going to find more degeneration in the hip socket on the long leg side. You can see that picture of the brain. The left side of the brain is bigger, and if you look really close, you'll see that in the prefrontal cortex, the right side is actually bigger than the left. That's because the right prefrontal cortex is the area for facial recognition, which is very important for human beings to recognize other people. So over time, we need to make sure we recognize who are friends and foes. And 100,000 years ago, if you were in a tribe, you want to have a big prefrontal cortex because you want to know who's in your tribe and who's in the other tribe. So that's why you're going to see a bigger forehead on the left, a bigger parietal bone on the left and a bigger forehead bone on the right, which is the frontal bone. So just to reiterate this, the heart's on the left, so the right lobe of the liver is bigger than the left. The left lung is smaller. Of course, the rectum's on the left. The appendix is on the right. I'm going to tell you now that the spine and the pelvis are asymmetric, and they're similar in 90% of your patients. You're going to find the same subluxation patterns. Now, chiropractic biophysics has a lot of interesting issues. I studied some of that, and I think it's a very, very good technique, as are all chiropractic techniques. They're all great. But this is from a biophysics article. They said that the range of lordosis in the cervical spine was between 16 and 66 degrees with a mean of 34 degrees. That means there's a spread of 50 degrees. 34 is really kind of a weird range if you can go all the way up to 66 and down to 16. And what this orthopedic study showed is that half of the adults had a lordotic cervical spine and 40% had a straight spine. 9 to 10% had a reverse cervical curve. But this is the exciting aspect of this study. Children had similar total cervical lordosis as adults. And what this study postulates is that cervical curves are actually genetic. That's interesting to think about. So I'm going to give you a list of some very, very common subluxation patterns. And these are patterns I think you will find occurring over and over again. And I'm going to show you how to find these patterns at Dr. John's homecoming. And hopefully you'll be there and join all of us. We'll have a great time there. And I'm going to show you how to find these subluxation patterns. So you're going to see that 90% of your patients have the same pattern. So you're going to find the right hip bone is usually AS, anterior superior, and the left is usually PI. I first thought about this when a friend of mine, who was our valedictorian of our chiropractic class at Palmer, he bought a practice, and we were talking after he bought this practice, and he said, this guy who's selling me the practice, he's an old guy, he's been practicing for a lot of years, and he adjusts all left hip bones as PI and all rights as AS. And I don't know what in the hell he's doing. It just doesn't make any sense to me because, this guy was really, really bright. Well, I remembered that and I started to look for that. That was one of the first things I started to look for. And I found that 90% of the time you do have an AS, what I call the innominate. You can call it the ilium, but the ilium's only part of the innominate. Call it the hip bone, that's better. You're going to tend to have an AS right hip bone and PI left hip bone. We're going to tell you how to discover that when you do your palpation, when I see you in January. The right hip is actually inflared and the left hip is actually outflared, as if it's turning to the left. Think about that. If you're a pitcher In your right-handed pitcher, you're going to want to be slightly turned to the left so you can bring that leg around. So that's why I think that whether you're throwing a spear or throwing a pitch or throwing a football, we've kind of shaped that way. Now, when I say the hip is inflared, Gonstead might call it an EX, which you look at the PSIS, it's kind of external. Diversified calls an I. I like to call it inflared on the right, outflared. So basically the right hip goes in and the left hip goes out. You're going to find that to be really, really common. Your right hip goes AS and the left hip goes PI. Your sacrum is usually anterior on the right, and the superior part of the sacrum is the most anterior. This is important because when you start adjusting the sacrum, whether you're using an activator gun, an electrical impulse gun, battery operated, whether you're using high velocity, whether you're using low velocity, it doesn't matter. You want to stay away from that very superior part of the sacrum because it tends to be anterior. And that's the area that if you thrust too much in there, you can aggravate them. So if this is anterior in the right superior sacrum, you want to actually put most of your force in the left inferior sacrum in most of your patients. Because that left sacrum in the inferior aspect is usually posterior. So it makes it easy when you start thinking about adjusting the pelvis, because once you do that, honestly, I'll often do the top, the bottom of the hip bone, the top, bottom of the sacrum, both sides, and I'll usually do everything, but I will put much more force on the left inferior sacrum and always think about putting more force with the consideration that the right hip is AS and the left is PI. And most mid cervicals are flexed. You know, that's, I don't know if this is going to be a new subluxation pattern or not. I remember reading D.D. Palmer, who said that most people's upper lumbars were posterior, and that was from riding horses. But I think the mid to upper thoracics, we're going to develop a subluxation pattern. And who knows, this is part of evolution. We're in the middle of evolution, everybody, right now. We're changing our shape. And I've talked to Dr. John about this before, and there's something called epigenetics where we are changing our genetic pattern. And, you know, if you have some young patients, you can say if you slump, it's possible, it's very possible to probable that you're going to have kids that are going to have flexed upper thoracic. So, you know, what we do now is part of our genetic code. So be careful. Most of us are right side bent in the thoracics. And when people hit a golf club, you'll see where they end up. They hold a posture where they're right side bent. When they're holding a computer mouse, they're mostly right side bent. Most of us, when we go to grab a door, we're right side bent. So you're going to see the spine tends to curve to the right. So you're going to have more left side bending subluxations. It's nice to know that. That will improve your results. I can guarantee that. You see him right side bending? That's part of pitching. So we're going to also go into extremities, but I'm kind of working on that part now. Most mid-cervicals are posterior. And I think we may be developing a race of humans, if we keep using cell phones the way we do, where we're going to have a lot of posterior mid-cervical subluxation patterns. So what I'm telling you is that there's already baked into us subluxation patterns, but you have to think about what your patients do, because what they do every day will create subluxations. 90% of your subluxations of the atlas are left anterior lateral atlases. And I think because we bend our head to the right, the atlas goes left and it moves anterior. So that's a very, very common subluxation pattern. And I'm now looking at subluxation patterns that are consistent in the tibia, and most tibia have what I'll call right rotation and right lateral shear. We're going to go over what that is, of course, at the homecoming with Dr. John. And I'm going to show you how these subluxation patterns of the extremities are consistent and predictable. Usually you're going to find, when you look at subluxations, you're going to find more subluxations on one side of the body than the other. We're going to go over how to find that, but you're going to find that subluxation patterns tend to occur in a group of 2 to 4 vertebrae that are subluxated. And I, right now, think it's from trauma or repetitive strain injuries, because I think these groups tend to vary from patient to patient. So when you're doing your chiropractic adjustments, you're going to start thinking about it in a new way once you come to the homecoming and you see this really exciting stuff. So a summary of this part is that 90% of subluxations are predictable. It's based on evolution genetics, and it makes adjusting really easy, and hopefully we'll see in January to learn more about this stuff. But there's more. I said there's 3 things. The number 2 thing is that the second thing, one of my problems is I speak faster than I think. So one thing that happens is that you've all seen the issue of what happens to a plant when you deprive it of light. And if you have kids, they do it in elementary school, you did it too, you see that all plants need light. Well, think about this. We're all African. That's part of our DNA. Even if you're blonde hair and blue eyes, a lot of you like to live in the Southwest. You like to live in the Southeast. You like to live in sunny Southern California. You like to vacation where it's sunny. And that's because we're all Africans at our roots, because we all came from sunny Africa. And that happened about 2 million years ago. Now it's proven that a lack of sunlight increases our need for vitamin D. And decreased vitamin D and decreased sunlight will cause more multiple sclerosis. It's been proven a lack of sunlight causes depression. So a lack of light actually causes disease. And so sunlight and light is something that gives rise to our innate energy. And most of us feel happier when the sun's out. Because this is where we came from, everybody. We came from sunlight. And when you go from this to this in northern Sweden, December and January, there's 0 hours of sunlight, you're going to have a high likelihood of getting multiple sclerosis or muscular dystrophy. Because you need light. You're very likely to have depression. When you go from this, where our bodies were accustomed to lots of light, and then you go to a situation where in Alaska, you were in darkness for so many hours of the day, it's very likely that you're going to have some diseases. So when I was living in Europe, I was living in England, almost everybody that was in the Northern Hemisphere, in January and February, they ran to Greece. They ran to southern Italy because they craved sunlight. And that's what gave them innate. And they really felt healthier when they had that. So evolution's telling us we need light. Well, if the body cries for light, what do you think we can do to help? And of course, there's light boxes and things to, for depression. But guess what? Light and laser therapy. Did you ever think why light and laser therapy cures virtually every type of problem in the body? It helps regenerate bone. It regenerates cartilage, muscle, tendon, ligament, nerves, brain, everything, because our body craves and needs light. But it's an evolutionary need. And we need more light. And that's part of the reason I think it's so healing, is because most of us don't have the kind of light that our ancestors had. And so light is something that is helpful and healing and regenerates tissue. Now, lasers are very, very helpful, but so are LEDs, and LEDs are getting much more powerful. So I've written, if you want to read my book, it's called Light and Laser Therapy Clinical Procedures, 6th edition. You can get it on Amazon. You can also get my newest book, LED and Light Therapy Clinical Procedures, 1st edition. That's on Amazon. And if you don't have a laser or don't sell LEDs to your patients, you're not going to sell lasers to your patients. It's too expensive and they can burn themselves. But you need to learn about light. Now, light can be weak or it can be powerful. I'm a big believer in powerful lasers. That's my bias. So you can see a powerful laser on the right and a powerful LED on the right and a weak LED on the left. It makes a big difference. And I call this powerful light therapy, PLT. And that's what's called the ultra bright, which is an 8,000 milliwatt LED. I use lasers in my office, but I sell my patients the ultra bright because I find that just causes them to get so excited. They refer their other friends in. Their friends come in, they buy these ultra brights. It's really wonderful. You have fun, you help more people, and you make more money. So the LZR ultra bright, you're going to see a lot about that, as well as the LZR7 and other great tools at the homecoming. And if you want to learn about powerful light therapy, you can go to lzrultrabright.com. There's a lot of information there. When you go to the website, you'll see that there's lots of info on how you can help more people, have more fun, and make a lot more money using these principles of evolution to heal people with light. So it gives your patients an evolutionary advantage. It helps them in many ways. And it helps you also become a more prolific, experienced, and happy practitioner. So it is nice when you help more people have more fun and make more money. That's a wonderful thing. It's a wonderful thing what we do, and it's wonderful that we can help so many people. Now, the third part of this, the third paradigm, is to add innate to your adjustments. Now, when you make an adjustment, innate does the healing, but there's an innate that happens when there's movement with the adjustment. So we're going to go over how to do this at the homecoming. I'm going to show you how to do gentle, high velocity, low velocity techniques, etc. How to use instruments, using motion assisted adjusting. I call this innate adjusting because when the patient makes the right movement, they're creating an innate pattern. Let's say someone can't bend their neck to the right with a torticollis. I have them bend their neck to the right and I do the adjustment. That's what I call an innate adjustment. And rather than saying line of drive, I believe in following the flow. You follow the flow of the innate, and that's what makes the adjustment. And when someone tilts their head to the right, they're telling you which way that bone needs to move. And all you need to do is tap it gently, use your activator gun, use your percussor, your impulse hammer. You can use your Gonstead diversified. You can use my LiteForce techniques, but you follow the flow and the adjustments are much easier and much more effective. And you can learn about this on my website. It's gentlemobilization.com, and that'll give you a lot of information about this type of adjusting. And it's important because all patients are different. A big athletic guy or a highly sensitive patient are very different. And if you have that patient using, the big athletic patient will use a lot of muscle effort. If I say tilt your head to the right, and the small patient makes a gentle movement, And that's using innate for different types of people. So the 21st century chiropractor, to survive and thrive, needs to understand these principles of evolution that help drive not only subluxation patterns, but using light and lasers. And by the way, if you don't have a laser because you can't afford it, buy an LED, use something, but start using light. These evolutionary principles are important if you're going to be in the 21st century. So you need to have powerful techniques and gentle techniques. And I mean, if at all possible, you want them to be relatively pain-free when you do them. Because little kids don't want you to hurt them, older people don't want you to hurt them, most people don't like a lot of pain. You need to be able to treat a wide variety of patients. I'd say don't get in the F trap of the 15 to 50. Broaden your age to treat babies. I treat newborns. I treat 90-year-olds. My oldest patient just died. She was 103. I treat athletes. I treat all kinds of people. And you do this by having technical skills. We're going to have a lot of technical skill issues that we're going to go over with you, so you learn a lot at this homecoming. What's the best technique? Well, there's all kinds of techniques. Do the technique that you love. It doesn't make that much difference. But you have to do some kind of mobilization or manipulation. You have to treat muscles. I use a lot of deep tissue that doesn't hurt. I treat the nervous system, and I try to make sure that things I do don't hurt people. Because if you do things that use innate energy, you don't have to use a lot of force. It's much more gentle, and patients love that. It doesn't mean you can't use high velocity, Gon said, diversify, but it means that you may not use it all the time. You may use gentle techniques. If somebody has osteoporosis, you may, ratchet that down to a lighter technique. You may want to do some more work with tissue levels. The problem with a lot of deep tissue is that a lot of people do it so it hurts, and we don't want that. We want to make sure it's gentle, and if you don't have a massage therapist in your office, if you're not doing deep tissue yourself, well, get a massage therapist if you don't want to do it, or do it yourself. And I've got deep tissue techniques on my website, and it's all free, so you can learn this all for free. Because you want to make sure you treat these small muscles because they can cause subluxation patterns. Deep tissue massage is great, but you want to make sure you get those small muscles that are very close to the spine, because that's very, very important for you, because those things can get subluxated. So if you want to learn about powerful light therapy, go to LZR Ultra Bright. If you want to learn about deep tissue and gentle mobilization, go to my website, gentlemobilization.com. And you can learn more about this. And by the way, if at the end of this webinar, which is coming up relatively soon, if you have questions, there's a box on your GoToMeeting, and you can start emailing those questions in right now. I'm going to stop a little early, and that will give you time to ask questions. If there's no questions, then we'll just say, I'll see you in January at Dr. John's homecoming. So we know that hypomobility causes stuck joints and subluxations. And the goal of a successful chiropractor is the patient needs to leave the office feeling better. That's very important. And if patients leave your office feeling better, I guarantee you they're going to refer new patients in all the time. My biggest problem in my practice is I get too many new patients. Right now, it's 3 to 4 weeks to get in to see me because I just have too many new patients coming to see me. That's part of my problem. There's always room at the top, and that's something we're going to learn about at the homecoming. It is survival of the fittest, whether you like to admit that or not. But if you have the best quality treatments and if you have the best techniques, you will be successful. There's nothing that can stop you. But here's one thing I think is important. If you don't know whether a technique will work or not, I would say try it. If you don't know whether it's safe or not, I would say don't try it. Don't take risks with your patients because there's many things you can do that are gentle, that are extremely helpful. So what is innate movement? When I say it, innate makes the adjustment. It's a natural active movement of the whole body. When you bend your body to the right, that's an innate movement. Your body is making the spine move in innate ways. And that's based upon evolution, genetics, it's based upon biomechanics. And the power behind this is Carol Lewis, one of the doctors I study with. I study with a lot of different docs and chiropractors. But he said that when you make a movement, that's the person's spirit. I'd call it the innate. But movement is your innate energy expressing itself in the spine and extremities. And I don't care if you do high velocity, low velocity. I do something called LiteForce, which uses innate energy, which is right kind of in the middle between the two. Now, there are some problems with high velocity adjustments. They're great, but people can be sore. The rate of stroke is between 1 in 500,000, 1 in 3 million. I'm not going to argue that. That's what chiropractic experts say. But here's what is stunning. This is what you have to realize. The natural stroke risk is 1 in 100,000. 1 in 100,000 people have a stroke just when they're backing their car to the driveway. They have a stroke when they just turn their neck. And the average age of someone having a stroke is 44. That's what scares me the most, not the adjustment. We know we can fracture ribs, we know we can herniate discs. We know it's hard on the body. I'm not saying you shouldn't do it. I've done Gonstead diversified myself. So, I think it's great. But just realize that the natural stroke risk is 1 in 1,000. And the fact that even if 1 in every 1 or 2 million or 1 or 3 million people have a stroke with chiropractic adjustment of the neck, even if that is true, 1 in 100,000 having it from backing out their car from the driveway. That's what scares me. So I say go with the flow. And if you have the patient move when you do your adjustment, you can really back off on the force and you'll have a lot less side effects. That's what I'm trying to say. And when I do my adjustments, I do some from the back, some from the front, but I always have the patient do some kind of movement because if they do that, it takes very little force on my part to create an adjustment. So I use tools. You can use a T-bar, you can use an impulse gun, you can use activator, you can use your hand, you can do a thrust, but you'll find if patients make a movement, you're going to find that adjustment's going to go really easily. And these are some of the things that I'll do, in my practice is rather than just thrusting like this, I'll have the patient make that movement. And the adjustments are just like butter. It's so easy and so safe. So I'll do that all the time in my practice. And that's what makes it really easy. That's me adjusting my wife. You can see she's smiling. And for pelvic adjustments, it's the same thing. I have the patient make movements that cause these bones to move in the proper pattern. So once I know how the bones are going to move with the patient's movements, and if I know how to make them move properly, and I know how it's subluxated, the adjustment just becomes easy. You have lots of time for nutrition and other kinds of things. So if this work interests you, visit me at gentlemobilization.com, or if you want to see some information about lasers, you can always email me. I'm happy to answer questions about lasers, about light therapy. And my website, gentlemobilization.com, is online. It's free. There's lots of great videos for you. And thank you for attending. And if you have any questions, email them in.
Dr. Turchin, while they're doing that, we'll see if Aaron has some for us. What percentage of your patients in a day you treat do you use laser on?
I would say about 90%, John.
And I would say for me, that's actually true, probably not 100% for me. And when you use this, do you treat multiple areas usually, or how would you evaluate how you would treat a patient with laser?
Well, the first thing I think about is that, as I said in the webinar, John, um, the body needs light. The body craves light. But if someone has very light skin, and let's say they're old and they have very light skin, John, and so the skin is thin, I'll use a lower dose because that's a body that's not used to a lot of light. If I get a patient who's in the sun a lot, I'm worried less about it. If I have a patient who's black, I know that their body can take a lot of light. The main principle is that you can treat multiple areas, but everybody has a limit. And if you want to test that, you can just start off with lower doses. And then each visit you see them, John, you can increase your total treatment time. And you will find at some point they're going to say, I got sore, or they'll say, I got fatigued. Either being sore at the site of treatment or feeling a little bit tired afterwards is a sign that you've hit a maximal dose. You can treat yourself that way. You can treat yourself and you can see that at some point it's going to cause what we call a parasympathetic effect and people will feel tired. If you go past that and treat even more, then people are actually going to get wired and they may have trouble sleeping. I would say that, well, let me ask you this. What kind of power laser do you use, Dr. John?
I used the big one, the new the new big one. What is it, 13?
13 watts? Yeah, so I would say you probably wouldn't need more than 1 minute in an area.
That's for sure. Sometimes 3 to 4 seconds is all it takes. The way we have done it with kinesiology is, let's say that you find an area that's weak, we go ahead and laser it till it goes strong. Then we know we've made an ample dose. If you stay a little longer, it'll actually go weak again. You've gone not too far, but plenty far. But if you stay there past the point you make it go weak again, now you're over-treating. And we don't want to over-treat any more than we want to under-treat. Let's say that we find an area that is painful, but we don't know what area to treat with that pain. If we have them touch it with their hand, another muscle that was strong will go weak. We call that therapy localization. So if we shine the laser on that area and the muscle that went weak when you touched it will now go strong. If it goes strong, then you're there. If you wait just a second longer, it goes weaker, you know you went as far as you could go, but definitely get out of there and don't stay there any longer. And in my area, though, I treat a lot of organs, too. Do you wind up lasering organ systems?
Yeah, I do. Obviously, it's not approved by the FDA, but you can always say that, a person's sore. But I do most of the organs I treat most commonly are the viscera, especially stomach, small intestine, large intestine. Those are the areas I treat the most. But what also is exciting, what we can go over also at homecoming, is treating the brain. Do you treat the brain?
Oh, yeah, absolutely, on every patient. And also the liver, since the liver has 500 functions, we definitely watch that. A lot of your recurrent subluxations come from liver toxicity. And in fact, there's something that it's not exactly the same line, but it is. And that is, I have a neighbor across the street since I moved back to Gilbert, Arizona, who has a bleeding disease, and he's wound up with really, really serious problems and lost an eye and walks with crutches, and he was literally dying. And he was in the hospital just dying, waiting if a liver would come, they could give him a transplant. Back in the days of hemophiliacs, they didn't know how to check the blood as well as we do now. And so they were giving these guys hepatitis C and AIDS and all kinds of things. And this guy picked up hepatitis C from a transfusion. So he's laying in there, he's dying, he looks horrible. And then a young girl, one beautiful girl, is killed in an accident. And the parents let him have her liver. He carries her picture around. She's beautiful. And he just feels so akin to this patient, and that saved his life. And his hair turned back black again from gray, and his skin became younger. So the organs are so important for correcting subluxations, so important for our overall health. we're not just pumping bones here, smashing bones or cracking bones or whatever we want to say. We're looking at the whole person. And the organ systems are very important, as well as structural correction, cranial sacral, visceral manipulation, as well as laser input. It's so exciting. Like you say, I talked to an attorney today, and she said, I just hate being an attorney. It's never any fun. I want to quit. You and I, how many years younger are you, Curtis?
I'm going to be 70 in December, and I still love it, John.
Exactly. And I'm 71. I'll be 72 in March. And we say, when are you going to quit? When you quit what? Having fun? And that's the fun part of this whole thing is everything we do helps people. And the more the innovations we can use, and we go back to old guys, they've been doing this for 40, 50 years. We've learned a lot of things we want to pass on before we go, that's for sure. And it's really a pleasure to have you coming to homecoming this year. We haven't had you there for quite a few years. And also Dr. Smaldone is coming. I noticed you had a picture there of somebody that was taped and while you're treating them, and he's one of the best evaluators, adjusters, and tapers on the planet. So we're going to have a wide variety of everything from specific instrumentation to light LIT adjusting like you talk about to nutrition. Dr. Porter is going to talk about the brain tap system and how to use the brain by very specific implementation of the equipment he has developed to absolutely change thought patterns. And like you say, genetic RNA, DNA can be changed by what we do. So it's very exciting to have you on board this year and to add your expertise to us. Aaron, did we have any questions we need to cover?
No, there are no questions.
Well,
okay.
I want to say one more thing, John.
Please.
You know, I want to make sure that those of us that are listening to this webinar, I know there could be quite a few of you who have it emailed to you and you're going to pick up on it. What John's saying is not something that he's just pulling in out of the air. There is research showing that laser regenerates the heart, laser regenerates the kidneys, laser regenerates the liver. This has actually been proven in studies. And, you know, I sold a laser to a medical doctor in Brazil, and this guy's pretty far out. You know, he does acupuncture, he does laser, he does nutrition. He doesn't do medicine. And he was telling me that he was treating people with kidney disease recently, and he was finding that just by doing laser on their kidneys, John, he was actually seeing blood changes, lab changes with kidney disease. So, I mean, this is stuff that's really real. It's not stuff that we're making up. This is real stuff that will help you cure patients.
Well, the really great part about what we're doing, and Dr. Curtis is a consultant to Randy Ringcleve and John Mooney and some of the innovations they have with the LZR and the X2s, the lasers that I use. And we have learned that if you can speak two languages, if you're bilingual, you're a little handier than if you only speak one language. They say you can tell in Americans they only speak one language, where other countries speak 2 to 7. And if you look at what a laser is, the wavelength is a complete language. So we're using red, where you can red and infrared. Infrared penetrates deeper. On some of the things we're using violet, red, and infrared. So we will show you different ways. Dr. Curtis is going to teach a whole class on laser. Dr. Brett and I will use them all weekend long. Dr. Randy and John will be out in the hall, and you can get about any kind of treatment you want. They're 2 chiropractors, and John still practices full time. So come to homecoming, and sometimes you learn as much in the hall as you do in the lecture hall. And we invite you there, to us old timers and the new kids on the block. And let's help you change your life for better. When I was in full-time practice, I was booked 3 to 4 months in advance. And it's hard to get people in like that. So I added 3 chiropractors and a PhD to help me, and we were still behind. That's when I started teaching, so we get more clinics, more doctors, more facilities doing this advanced wellness care. And I could get a vacation once in a while. So Dr. Turchin, thank you so much for coming on board. We have a listenership, a readership of about 20,000. This will go out to them in the next few days. And if you signed up, it'll come out to you tomorrow for sure. Thank you for being here, and God bless you all. We look forward to seeing you at January homecoming, January 4, 5, and 6. And actually, we'll be doing treating. Maybe we get Dr. Turchin to come in earlier the night of the 3rd on Thursday. Dr. Brett, myself, and a lot of the other doctors jump in. I think Dr. Harris is going to be there, Dr. Turchin, Dr. Smaldone. So you can get treated. If you have a specific desire to one of the physicians that are on the list, then call Jason. Jason is the office manager. If you can't remember the number, you just go to brimhall.com. That's easy enough. 866-338-4883. All right, Dr. Turchin, thank you. All of you listening in, Aaron, for helping us make this happen. We'll see you in 2 weeks. Bye-bye.
Thanks very much. Bye-bye.